welcome to News9. I'm Bansi. Obesity is no doubt a medical condition that poses several health threats. But now there is some more bad news. New research shows that very soon obesity will be the #1 deciding factor for cancer. This means lack of activity and the availability of fat-rich foods will lead to obesity, and this will be the #1 deciding factor for cancer in 10 short years. The study was conducted by researchers at the Oxford University. Obesity will shortly overtake smoking as the risk factor for cancer. Obesity-caused cancer is directly linked to 32,000 deaths due to cancer in the United Kingdom each year. Not only does being overweight raise patients' risk of developing cancer, it also means they are far more likely to die. Well, are you obese? Talk to the experts, find out what to do to avoid the risk of cancer. You can talk to our experts. Call us on 223-60303 or 04 or text us on the numbers on your screen. Now, to talk about this, we have two experts here in our studios. The first is our senior oncologist, Dr. Bhawna. Hello. And we have Dr. Ramesh, who is a bariatric surgeon. Hi. Now, first let me come to you, doctor. You deal with cancer day in and day out. You're an oncologist. Now, does this kind of study surprise you?
I think we have known that obesity or being overweight and avoiding physical activity for a long time can lead to cancer. Okay. It is one of the risk factors for developing breast cancer. We've known about it. But now we know that patients who also have cancer, the risk of cancer coming back actually goes down in those people who exercise and are not obese or overweight.
Okay. Now, the big question we have on the one end of the spectrum, we have women who are extremely frail and thin. And on the other end of the spectrum, we have women who are overweight. I'm talking of breast cancer. So where do we, say this amount of fat is fine? Because, where is the safe amount of being overweight or fat, or where is the, the right weight?
So, you calculate whether you're overweight or obese by your body mass index, depending on your height and weight. So, and we have certain figures which we've learned by doing research on thousands of ladies and the whole population. So, if your body mass index is up to a certain level, you're classified as overweight. Okay. But if it goes above 29 or 30, you're classified as obese. And we've learned that if you are in the overweight or obese category, then you're more likely to develop breast cancer. And if you lose weight by physical activity in premenopausal women, the risk of developing breast cancer goes down by almost more than 25%. And it goes down by even a higher degree if the ladies are postmenopausal.
Now, doctor, you deal with fat day in and day out. You are a bariatric surgeon.
Yes.
Now, fat is not good. All of us know that.
Yeah.
But yet, many of us like to binge on, let's say, a packet of potato chips or things like that.
Yes.
Now, fat kills. At the end of the day, fat kills. Now, it could be cancer.
How it kills.
How it kills is the question. How does it kill?
Yeah, fat can cause a whole lot of diseases. I can call it a mother of diseases because it can get you diabetes, it can get you high cholesterol, it can get you a lot of joint pains because of the extra weight, it can get a lot of breathing problems because people are not able to breathe, then it can be a cause for heart disease. But then this is something that we all knew about. There is a lot of high rates of cancer, not every cancer, but we have found that in women you can have uterus cancer, breast cancer, large intestines cancer, kidney cancer, and
all related to fat.
Gallbladder and liver cancer. All these are much more in obese ladies when compared to non-obese ladies. So
also holds good for men?
In men, all these cancers along with stomach cancer and prostate cancer are higher incidence when compared to non-obese.
So let's say you have a man 60 kilos weight And someone who's 100 kilos,
Yes.
weighing 100 kilos,
Yeah.
someone who's weighing 100 kilos has a greater chance of cancer.
Yes.
Other
There
things
is-
being equal.
There is about 3 to 5 times more chance of developing cancers in people who are obese. The incidence is so much more. So we have this BMI, as Dr. Bhawna said. So people should know what BMI is so that they know where they stand. So we have their height in meters and then weight in kilograms calculated. So supposing somebody is 5 feet height, a lady who's 5 feet height and 60 kgs in weight, that's an average that you find. So the BMI is 60, that is height in the weight in kgs, divided by height in meters by square. So height in meters, 5 feet is 1.5 meters, 150 centimeters. So 1.5 into 1.5, that is 2.25.
You have the BMI chart
Yes.
that is displayed, but yet we are a nation
Yeah.
that has shown signs of schizophrenia when it comes to this issue of fat. We are still a nation where mothers would like their children to be nice and plump.
Yes, yes.
We are still a nation where mothers overfeed their children. And usually they say a fat child is a fat adult.
Yes.
Yes.
So where is this?
No, it's leading to a lot of diseases. We know that youngsters 20, 25 years old are coming to us with diabetes, they're coming with heart attacks, and then there's a whole lot of cancers that are rising. A person who's 40 BMI has 5 times more cancer risk when compared to a person of 25 BMI. I'm talking about a breast cancer. So it is like that. So people have to be in the healthy BMI, that is 18 to 23. That is the healthy BMI.
Doctor, I want to ask you, let's say someone suffering from fat related cancer, someone who's obese and has a problem with cancer. While in the West, let's say if you get into a hospital in UK, you've been to the UK many times, you said.
So I worked there for 14
You worked there for many years. Now, if you go into a hospital in the UK, the incidence of a person suffering from cancer is usually, most of them are over 50 years of age. Here you have an underaged group. They are in their 20s and 30s. Here in India, what is the problem? Is it genetic? Is it food related? Where is the problem?
See, the population of India
Or are we
is
just an unhealthy nation?
the problems that we face in India are slightly different from the West. Yes, obesity is a huge issue in the East and the West both. But for us, tobacco-related cancers and infection-related cancers, cervical cancer, HPV-related cancers, these are more common. Fat is going to be a huge issue for us as well, because we are seeing that in urban areas we are getting, our lifestyle modifications are such that we are becoming more and more westernized, or what we call urbanized. So we are marrying late, we are having children late, we are having junk food, we are not exercising. So all of these are moving towards the West and getting the Western cancers like colorectal cancer, breast cancer. Now, breast cancer, Bangalore is the breast cancer capital of the country. The incidence is the highest.
Why is that?
Colorectal cancer is one of the highest in Bangalore and Goa. Again, because of possibly the Western diet. And
Western diet, what do you mean Western diet?
diet is more less of fiber, more
Less
of meat,
fiber,
more of, there is some indication that red meat, consumption of more of red meat can also cause colorectal cancer. But again, it's lack of exercise, having junk food, not having the time to maintain a healthy weight.
Doctor, in simple terms, can you explain to the layman? We have viewers watching this, so there's can you explain to the viewer in simple terms what is cancer?
See, cancer is normally in our body, the cells divide, and then they.
So in all our body, cells divide.
Cells are dividing,
It's a
because our
normal process.
hair grows. That means the hair follicles are dividing and they grow. But it's a controlled growth. They're growing in a controlled fashion. What happens in cancer is either due to genetic factors or environmental factors. Environmental factors is where fat and tobacco and all these come in. So genes or environment, they cause a trigger to the cell that goes the other way, goes haywire and starts dividing in an uncontrolled fashion. Either it starts dividing in an uncontrolled fashion or starts growing in an uncontrolled fashion, and which is what causes cancer. The thing about fat is, obese person means more fat cells. Fat cells means you produce more of hormones like estrogen, testosterone, and insulin.
Yeah.
You know, so all of these go in the bloodstream, and they actually act as food for cancer cells. So let's say there is some trigger that has been there in the genetic makeup of the person because of some family history or some other reason, and this insult by the fat cell or these hormones will just make that cell what we call mutation and turn into a cancerous cell, and it starts dividing. So, and you don't know, being lean doesn't mean you will not get cancer. You may still get cancer being lean and thin, but being obese or overweight means that you actually bringing your risk forward by causing insult to the cancer cell. So suppose you're going to get colon cancer at the age of 70. Because of all this, you may get it at the age of 50. So you brought it forward by almost more than a few decades.
Because you've been to so many hospitals in the UK and in India.
Yeah.
Why are we, having cancers so much younger, 30 years younger?
I think our population is younger, and also if you go in the villages, you will have elderly ladies or gentlemen with cancer as well. But when you come to cities, they are tertiary cancer hospitals. So a person is young and fit, they will choose treatment and go to these hospitals. So I think it's mainly related to that. I don't think we can say for sure that
are we just more unhealthy than the West?
I think as far as our smokeless tobacco and cervical cancer, risk factors for cervical cancer, I would say that yes, these are the major risk factors.
And we are the nation, with the highest incidence of cancer in the world? No,
actually you're wrong. We don't have the highest incidence of cancer in the world. So, let's say breast cancer in the West would be more than 100 per 100,000 population. In Bangalore, it's about 37 per 100,000 population. Say in Bombay, it will be 25 per 100,000 population. So the incidence is not high in India at all. It's because of sheer numbers.
Okay.
We are such a
we
huge
have
population.
a population.
So the numbers look bigger.
Numbers are very large.
But the incidence is low.
But the incidence of cancer is still
Incidence means new cancer cases. So the new cancer cases which are diagnosed are low compared to the West. So the incidence is very high in the West compared to...
Are we the country with the highest number of cancer cases in the world?
No, we are not. I mean, I think we have, I think this is going to be a huge epidemic. That's what you've highlighted. I'm glad you brought this up, that, unless we actually as a nation think about our health, think about things which are in our control. Don't smoke, don't have alcohol, maintain a healthy weight, don't take self-medicate yourself, discuss with a doctor, do yoga,
often people think, I can get away with this. Doctor, correct me if I'm wrong, most of your patients will tell you that, deep down, in their minds, they think, okay, this bag of chips is okay.
Yes.
My body can take it. Okay, and the next one, and this burger is fine. My body can take it.
Yeah.
This is how we lie ourselves, lie to ourselves to eat that little extra. Is that how we end up becoming fat?
There are a whole lot of things here. One is we tend to condition ourselves to believe what is nice for us, what we enjoy as being good. That is psychological conditioning. The second part is all about thinking that what is there in the West is the best, and what is there in our tradition is not as good.
Like for example, what is in the West is the best?
About junk food,
okay.
the type of foods that we've been having.
You're talking of potato wafers, chips, you're talking of burgers,
you're
talking of pizzas.
Yes. So there's a whole lot of bakery products.
Okay. Please hold on to your thoughts, doctor. What is in the West is not the best. We talk about this after this very short break. Stay tuned. Welcome back. We're talking of obesity and cancer, the link, and we have experts in our studios. You were making a point, doctor. How do we lie?
We lie to ourselves. We want to believe what is enjoyable is the best. And then we tend to eat a little more. That is one thing. Number two is we are getting into the stress that the West has always been in. So there's a lot of mental stress from because of competition in the world, and this mental stress makes us get out our stress, and that's the easiest way you do it. Eat. At the end of the day,
can you just say that again? So, in other words, a person who's carrying a lot of stress up here
yes,
will tend to just eat a little more.
yes,
Is
yes.
that
is an eating behavior. That's
it's an eating disorder?
Yes, I would.
It's like binge
I would
eating,
say
you know?
it's a behavior. Yeah.
It's like going on a binge and just eating.
You de-stress by so many ways, and then one of the easiest ways of de-stressing is trying to eat a lot, and that's an eating. It's a binge. They get into a binge eating. And there are some people who eat a lot when they are lonely. People eat a lot when they are in stress, and all this slowly they get into obesity, and then they get into something called a set point. They come to a higher weight, and they're not able to go down.
Okay.
They go somewhere to a nature cure hospital or somewhere. 15 days they fast. They go on liquid
They
diet.
become slim and they come back.
5-10 kgs. They feel so good, and then they're back, and then their normal habits come back, and within no time, 2 to 4 weeks, they're back again where they started. And in fact, some of them increase another 1 or 2 more kgs. That's called a yo-yo phenomenon. So the yo-yo is the thing that you play with, you know. So their weight keeps going up and going down.
So which means they go lose some weight, come back, and not only gain back the weight they've lost, they gain a little more.
Yes. And that's how repeated attempts of weight loss, when it is not with a full punch, it keeps making you gain more weight rather than make you lose weight.
Okay, so the fight against fat is up here really.
Yes.
Really? Now, doctor, coming back to you're the cancer expert. You have dealt with many cases of cancer really. How much of a fight against cancer is up here?
I think just a lot of studies have shown as well, and from my personal experience, a positive attitude does help. So
What do
when
you
a
mean by
patient, positive attitude, I think, when a patient is diagnosed with cancer, the whole world falls apart. It's like a huge shock, not only to the patient, but to the family.
It's like pronouncing a death sentence.
But
is that it?
yes, but that is wrong, because it's the C word that everybody is scared of, and I think we have to destigmatize cancer, because
Cancer is still curable.
Cancer is curable if you detect it early. So it's very important that we do things which are in our hand to make sure that we don't get cancer. So which is what we call primary prevention, and also
what are those things you do?
So things like what we discussed about exercise, not smoking,
get some exercise,
alcohol.
don't drink.
Exercise
don't
means what I would like to say is that this study which was presented showed that 150 minutes a week of exercise, which makes you get your heart rate up. So just going for a simple walk I would not call that as exercise, but 20 minutes daily of your time, where you get your heart rate up and you do any kind of exercise. If you love dancing, you dance, run, some weight bearing exercise. So all of these things will come in primary prevention. Secondary prevention is getting yourself vaccinated against things like hepatitis B, cervical cancer. So that will be secondary prevention. And if you do go for screening and checkups, then that in some cancers like colorectal cancer, breast cancer, there is some evidence that if you screen for cancer, you detect it early and you cure those patients. So if you detect them in early stages of cancer.
India, you were speaking about the different incidences of cancer, different types of cancer that are seen in India.
Yes.
What types of cancers are seen in India?
See, if you take Europe, it's a big country, different countries.
Big continent.
Big continent. Same way, India is like a big country with small states. And each state has a different dynamic. It's mainly to do with the food habit, the lifestyle and everything. Like in the Ganges belt, gallbladder cancer is more common.
UP, Bihar, that area?
UP, Bihar, West Bengal, Assam, because wherever the Ganges belt is. And then you have Northeast, where stomach and food pipe, esophagus cancers are very common.
Like
again, dietary
Northeast
patterns.
is all the
Seven
Assam,
sister states,
okay,
yeah.
Tripura, all
Manipur, Arunachal.
What could be the reason for that?
I think we think it's related to diet. A lot of studies are being done. The ICMR is doing quite a few studies. The Tata Hospital in Bombay is doing quite a few studies where they're looking at the causes of cancer in various areas. In Jammu and Kashmir, it is stomach cancer. In Bangalore, it is breast cancer and rectal cancer. In Goa, it is rectal. So all the states have a different dynamic of cancer if you look at it. And it's, I think, to do with the way we live and most of it, I think 50% of cancers in India are preventable.
Okay. Also, they call the mouth cancer as the Indian cancer.
Yes, there's an amazing study presented actually from, it's a New
Why
England
is it
Journal
called the Indian cancer?
paper in Chicago it was presented. It's called because it's very common in India. So we are a nation, as a nation are specialized in, you know, smokeless tobacco. Zarda, kheni, pan masala, rajnigandha, all of these things, you know, they cause cancer. And it's smokeless tobacco. Nobody else in the world uses.
Kheni is the tobacco which they...
Katha and pan maize, you know, you put it in pan, it's a betel leaf. So all these things, you know, they irritate the lining of the mouth, and constant irritation, things like even an ill-fitting denture can cause cancer. So constant irritation, that means, you know, you're constantly insulting your body by doing all these things, having very hot tea, having, so you're kind of insulting your lining of the stomach, very spicy food, very hot food. Again, you're insulting the lining of the stomach.
The Andhrites are known to have very, very spicy food.
But you know, stomach cancer is very common there.
In Andhra?
In the Andhra. And in South India and East India. Again, there it's the smoking of the various meats. And here it is the spices, very spicy food. So basically, you know, you are constantly, one, if you have slight gene issue, and then, you know, you keep insulting your body. So I think you can negate all of this, quite a lot of it, by exercising. Because you produce certain kind of hormones when you exercise. It boosts your immune system. That, you know, it automatically, things which may be happening become self-limiting.
Doctor, now you are a, you know, expert in it's
loss.
good people are fat for you. Okay, so how do you advise them?
I wouldn't say it's good for me. I'm in a specialty where it's necessary today. We need to make people thin. What was the question again?
How do you deal with them? Because fat people are fat, whether they, you know, they are there, they're there.
So I always tell people the ABC treatment of anybody who's overweight or obese is D and E. There's nothing else in this world. There are more than 1,500 books written. There are ads coming in the TVs every day, about 10 or 15
Because India was
ads.
a malnourished nation just
D,
a few decades ago. Now we are a fat nation.
There are more people dying today of obesity than starvation.
In the cities.
Yes, that's the enigma.
In the cities. In the metros, not in the villages.
It's an overall statistics.
In India?
And we have today a whole lot of diabetics, which is increasing in India, and we have a whole lot of heart disease which is increasing in India, and both are related to obesity. I'm not talking about the regular obesity causing cancer diseases.
So if someone is fat,
there's
a good chance that person will die, not due to cancer. Then there are many others that could kill him.
Other reasons for him to die.
How fat is that a fatal fat?
See, the fatal fat, we have something called morbidity, and we talked about how morbid and how bad their health can be. So we have class 1 obesity, class 2 obesity, and class 3 obesity. Class 1 obesity is a BMI of 30 to 35. Class 2 obesity is 35 to 40. And anything more than 40 is called class 3 obesity or morbid obesity. Because here, no matter what, whether he has diabetes, he has hypertension, he has no disease whatsoever, still that amount of fat is not good for him. It's not healthy fat to be more than 40 BMI. And slowly they get into some disease or the other.
Okay, so if the BMI of the person has to be 50 kilos.
It's always related to the height.
Correct. If the BMI, let's say, is 50.
Yes.
And if the person is 40% more. Okay, so you're talking of in the numbers.
Yes.
How much would it be? If let's say if a person is 100 kilos, according to his height, he has to be 100 kilos weight.
I'll give you a very, very easy rule of the thumb. You take somebody's, what a lay person can think of, his height in centimeters. Say he is 168 centimeters. He has to be 68 kgs. He is 170 centimeters. He should be 70 kgs. Minus it by 100. That's a usual, very basic thumb rule. And so if he is beyond that, say 25, 30 kgs more than that, that's not good.
Okay, I want to ask you, now older people, let's say someone who is 60,
yes,
with the same height will be you know, a little heavier than someone who's, let's say, 30.
No, age has nothing to do with BMI.
Yeah,
BMI is WHO defined classification of obesity.
I'm talking of the weight of the person. Let's say
Yes.
a 30-year-old man will be less, let's say he's a 6-footer, a 30-year-old 6-footer, tends to be thinner and less heavy than a 6-footer who's, let's say, 60 kilos.
See, a lot of, I wouldn't say we can only go by BMI, because you may get a sumo wrestler who's about 300 kgs plus.
Yeah.
But I wouldn't do a weight loss surgery for him. He's very fit.
He's very fit.
I have a cousin of mine who's 100 kilos, but he runs a marathon. Nobody would ever touch him, because the weight can come from fat, it can come from muscles, it can come from bones.
You have a cousin who's 100 kilos.
but then he
But did he
runs a
inspire you
marathon.
to get into bariatric surgery? No.
Not him, but then it is the
That
challenger
other relatives?
surgeries that makes us get in, because this is one of the toughest surgeries and the most promising. You do your surgery today, tomorrow he starts losing weight, and somebody who's 250 kgs comes back with 70-75 kilograms, and somebody who's taking 200 units of insulin, tomorrow he doesn't need any insulin, no tablets for diabetes. That's what keeps us going. Weight loss surgery is so, it gives such dramatic results.
Okay, but I've heard,
Yes.
I've heard from people that someone who goes in for a bariatric surgery,
Yes.
at some point tends to put back exactly the same weight that you've removed.
No, that doesn't happen.
No?
See,
I've heard it
I would,
because
very good that you asked me
Yeah,
this
yeah.
question. They
Because there have been cases.
There are a lot of people who can get back some amount of weight, and that happens because they don't understand the concept. Weight loss surgery is one tool to make them lose weight and also help them maintain weight. But then it is the patient who loses the weight and maintains the weight. It is not the doctor. It is one surgery doesn't mean that he can go eat burgers rest
and
of
go
his
on a
life.
binge for the next 5 years till he puts back all that.
His lifestyle is very important. So we don't pick up people who have eating disorders for these surgeries. People who don't understand and have mental stress. It is only after they are willing to do a lifestyle change can they undergo a weight loss surgery. That is very important.
Lose some amount of weight.
They have to show us that they can diet, they can exercise, they can lose a little weight, or they are conscious about what they would be doing rest of their life. Then they can undergo a weight loss surgery.
Now, doctor, you spoke of positive mental attitude. What is positive mental attitude? Because it's such a term that people speak about it. What do you mean by that?
See, positive is like, just facing. I have a patient who did not give up a single day's work while she was undergoing chemotherapy for her breast cancer. Not one patient, I have numerous such patients who just carry on with their life completely normally as much as they can, even while they're undergoing radiation therapy, chemotherapy for their cancer.
They keep their spirits up.
They keep the spirits up because it keeps them mentally occupied, and also I think that's a biggest stress buster to keep yourself occupied, stay positive. It's good for everybody around you. They come and actually encourage the patients in the daycare also to they actually inspire other patients to do the same as well. So we actually also do at our cancer center in Majumdar Shaw, we do a yoga class every Saturday. So again, this is not only to promote exercise, but also to promote a sense of well-being, meditation. All of these, actually the West is moving towards the East. They are doing a lot of this. And I think we are very lucky in India to have all of these to help the patient.
Doctor, often they say in cancer, when it comes to fighting cancer, people will tell a patient many things, but what that patient tells himself is more important than what anyone tells that person.
Yeah, I think especially in India, we have a lot of, we give advice to everybody.
Absolutely.
And sometimes it can be quite negative also. And the majority of, and all, if you have, even if you have a small cold in your family, they'll ask you to consult 5 doctors. So if a patient...
If you have a cold, they say have a nice
and
60 ml of brandy and it'll make, do a...
Or self-medicate yourself.
Absolutely.
Yeah.
Is brandy any good for cold? They
So
say have brandy.
Yeah.
Just go to sleep.
Or, you know, they'll just say have some Ayurvedic treatment or have
Yeah,
homeopathic
correct.
treatment.
I want some clarification on this. Is alcohol good? Yes, no.
No. Any amount of alcohol or tobacco is bad.
Okay, any amount, even let's say one drop of it is bad.
Bad.
That's it.
Yes,
period.
absolutely. To say that, you know, you just, even passive smoking is bad. So passive smoking is where, you know, you're inhaling the smoke. And ultimately the tar and the nicotine does go into you even if you're passively inhaling it. So any amount of both of these things are bad.
Doctor, also is obesity related among women to menopause?
So I think, you know, it's with the hormonal changes in our body. Yes, some of us do tend to put on weight, but again, I think it's more to do with lack of physical activity. Because so I have ladies and friends who've maintained the same weight throughout just by exercising. So I don't think it's directly, there's no evidence to say that, you know, just because your ovaries have stopped functioning, you should put on weight. But that's an excuse we say mentally that, you know, that this is the reason why I've put on weight. Or if you've had children, then you're not able to lose the fat. I think it's very important.
Do you have slides to explain this?
Yes.
About change in risk of post-menopause?
So, you know, if you see this study which was done in more than 35,000 ladies in Iowa, so, you know, you look at the change in weight where they gained 5% or they lost 5% or they maintained a stable weight. The ladies who remained stable had almost a 20% less risk of developing breast cancer. And those who lost more than 5% of their body weight, their risk of developing breast cancer went down by 40%. So, you know, you can see this decline if you're losing
those who
weight.
gained weight?
Those who gained weight, I mean, that's the baseline we've taken. That, you know, they have the highest risk of developing breast cancer.
Those who gained weight in that period, the chance of cancer went up by?
By about 50%. And so, you know, in premenopausal ladies, if you exercise, if you look at the next, if you exercise, the risk goes down by 27%. And this is, you know, hard evidence that has been published after looking at thousands and thousands of women. And ladies who exercise, you know, physical activity in postmenopausal women, it goes down by 31%. So, you know, it's such a simple thing to do, to just exercise 20 minutes a day. It's I think you should give that much time to yourself in a day.
Doctor, you have another one of your colleagues at Narayana who speaks of a multi-pronged approach in dealing with cancer.
The integrative approach.
He says cancer, all of us are not just physical beings, we are more than physical beings.
Yes.
So he speaks of an emotional therapy for, you know, for cancer. He has something for, you know, what exactly are you talking about?
See, this is what we call integrative oncology, and Dr. Santosh Gowda at our center leads on it. And basically, it's healing the mind and the body together. Yes, we can do various treatments for the body, where we can give chemotherapy, surgery, radiation therapy, but we have to heal the mind as well. So that is
what is healing the mind?
That is where, you know, providing, it's like, you know, you nourish your body, but you need to nourish your
because
soul
Dr.
as well.
Santosh Gowda, you know, you have spoken of things like forgiveness. What does forgiveness got to do with cancer?
See, what he means is healing the mind means things like meditation, yoga. So, you know, all of these promote peace of mind. And so, you know, what we want to do is not just treat the patient, but not treat the patient in a holistic way.
This holistic treatment, does it yield results, or is it just like a placebo?
So this is what the study which was presented in Chicago, they had certified exercise specialists who every week called these ladies with the ovarian cancer, it's one of the gynecological cancers, and that showed that, you know, ladies who did this, the certified exercise specialists who did this holistic care, these ladies, even though they had stage 3-4 cancer, they had a much better quality of life than those who just had active treatment. So I think, yes, it does yield results.
Also another issue I'd like to ask you also, Doctor. Speaking of the mind, you know, they say that women who have happy marriages are healthier, even though they might be a little overweight. What has marriage got to do with cancer?
I am not aware of this.
You're not aware of it, Doctor?
Yeah.
No, I don't think there's any publication, at least research publication, talking about marriage and cancer.
Okay. Happy marriages. That's the
Yeah.
key word,
There
not
is
marriage
some,
and
no,
cancer.
there is some
the
evidence.
key word is happy marriage.
It's not the marriage, it's to do with stress.
Yeah.
So stress does, you know, a lot of people will say that, you know, I had some divorce going through or something and I got diagnosed with cancer.
Absolutely.
And I had this going on. So these
So
kind
there
of
is a
things,
link you see in it?
there is some anecdotal evidence that yes, stress, you know, can lead to. But again, there was a randomized trial again in UK done where half the people were very stressed and half not, did not show any link. But there is a lot of anecdotal evidence. In my own personal experience, I see patients who are positive, they kind of sail through the treatment. But patients who are very scared, you know, every side effect, and they tend to have quite a few of those.
Hypochondriacs.
So, you know, it's important to stay positive, nourish your body, nourish your soul, and exercise. I think that's very important.
And depression is one of the main causes for obesity.
Yes.
Depression is linked to obesity.
Yes,
Yeah.
yes.
You
A
eat.
whole lot of.
Yeah.
What is depression? You're talking of clinical depression?
For
Someone
any
who's in
reason,
a
clinic,
clinically depressive?
A lot of people who are depressed eat a lot of food, and it is vice versa. People who are obese also get into depression. It can be both ways. And
It's like a
then,
catch-22.
yeah, it's a catch-22 situation. And a lot of medicines that they take, antidepressants, also cause obesity. They make them put on a lot of weight.
So it's like a horrible cycle of depression,
Yes,
eating,
yes.
overweight. It's
Yeah. So as Dr. Bhawna said, healthy food habits and exercise. Exercise, I always tell everybody, 20 to 25 minutes of sweating when you're exercise. You may exercise for 45 minutes, 1 hour, doesn't matter. But that 25 minutes of sweating is very important.
It's very important.
Very
We have a caller joining us. Sunita from Kamanali. Hello?
Hello,
Yes, Miss Sunita.
good evening.
Yeah, good evening.
I'm just watching your program. It's
Okay.
very educative.
Yeah.
I just have a question to these doctors. Is obesity and hereditary?
Is obesity
yes.
hereditary? You should
Yeah.
tell us.
It is.
Good old days, I have my sister's daughter.
Yeah.
Actually, our grandparents and parents, they're all very big built.
Yeah.
So this kid also is big built, but parents, my sister especially, she's always scared to give her food, serve, and she says, I don't want you to become like, parents,
Yes,
like
yes,
grandparents and great grandparents.
Yeah.
So those days, our parents and grandparents would have eaten the most healthiest food.
Yes, yes.
Those days, no burgers, nothing.
Yeah, yeah,
But
yeah,
still,
exactly.
that heredity is there, big built heredity.
Yeah.
So I just want to know, has that anything
Yes,
to do with this
it definitely
obesity?
has. You see, normally
Yeah.
we look like our parents. That is
Yeah.
to do with genes. So when we say we look like our parents, it's not just the facial features, it's the whole body, the height, the weight and everything.
Yeah.
So it's basically to do with genes, because genes dictates your body metabolism. So
okay.
the metabolic rate, we have something called body metabolic rate. So the
Okay.
genes will definitely dictate on what your body metabolic rate is, and that will dictate on how much fat you can burn.
Okay.
So somebody who eats very little can still be very fat. Somebody who eats 3 times that much can still be thin, and that's because their
Doctor,
basic
this
body
is what-
metabolism is
yeah.
different, and
This
that is
what
again
happening,
dictated. Yeah.
Actually, the child is eating very less. Hardly she takes one chapati because,
Yes, yes.
classmates tease, like neighbors, children tease and all those things. I see, other kids who are very thin, they actually take lot of quantity than this kid. Sometimes I feel bad, when
Yeah,
they-
that
they-
is true.
I hope
But at the
child
same
will
time, you
not
should not stress out a child saying you don't eat. See, not
Ah.
eating is not good, because they should not feel hungry. They should not stay hungry. Staying
Yeah.
hungry increases a hormone called ghrelin in your stomach, and that hunger will make that person eat a lot later on. So that is what happens to people who go to Jindal or somewhere for 10 or 15 days. Then their serum ghrelin levels are very high, and they come back and start binging. So you have to fill up their stomach, make them do a lot of exercises, put them into games. Don't stress them out saying go to a gym, do this exercise, do that. They have to enjoy what they're doing, and
Doctor, she's very active.
and
she takes
give a lot of
all-
proteins.
But it's purely heredity, because we had taken her to Manipal hospital also and had her hormones checked.
Yeah,
Everything is normal, the doctor said, the reports say.
Yeah,
But she's big built. No, that's why I was thinking, has that anything to do, any bad effects on the health, like.
And as Mr. Bansi said, a fat child will become a fat obese later on. So I think we've got to be very careful with these kids and try to make them lose weight or maintain their weight and not getting into adulthood with obesity. That's very important.
Well, we are at the last part of our program. Whether we like it or not, India is getting fatter.
Yeah.
Where do we draw the line and tell them enough?
Yeah, see, we have the Asian population which is having much more heart attacks, about 40% more heart attacks when compared to the rest of the world, the Westerners. We have something called Caucasians, that is the Westerners, who have a diffuse obesity. They have fat all over the body. They're like a barrel. But we are apples and pears.
Mostly big paunches.
We have a pot belly, and that is a different fat. We have the white fat and the yellow fat. The yellow fat is outside and the white fat is inside. That is what is inside your tummy is hormonally active. It secretes a lot of hormones, and that increases your cholesterol, that increases your insulin resistance, that increases your heart attack chances much more. So though we say in the Westerners we say 30 BMI is okay. For Indians, we say 27.5 is obesity. Though we say 25 BMI is okay for Westerners, we say 23 is what you should be. 18 to 23 BMI is what we should be. So that's very, very important.
So with that, we come to the very last part. Thank you, doctors, for joining us on this program.
Thank you.
This is the hard to digest fat truth that obesity and cancer are linked. Obesity, of course, is not good for a host of other issues. But now we know it can also cause cancer. With that, it's a wrap on this. On the other side is a news bulletin. Stay tuned.